Simplified explanation. Metaplasia happens when one type of cell is replaced by another type that can better handle a new or harsh environment. This change is controlled by stem cells and usually occurs after long-term irritation. For example, in acid reflux, the esophagus lining, normally flat cells, changes to cells like those in the intestine. This is called Barrett esophagus. In smokers, the normal lung cells, which have tiny hairs, can change into flat, tougher cells. If the irritation continues, metaplasia can become dysplasia, a dangerous step toward cancer. Even tissues like muscle can change. For example, after injury, muscle may form bone inside it, a condition called myositis ossificans. USMLE question 1. A 55-year-old man with a long history of acid reflux is found to have intestinal-type epithelium in his lower esophagus during an endoscopy. Which of the following best describes this finding? A. Dysplasia. B. Hypertrophy. C. Metaplasia. D. Hyperplasia. E. Neoplasia. Correct answer, C. Metaplasia. Explanation. This patient has Barrett esophagus, where the normal squamous cells of the esophagus are replaced by intestinal columnar cells due to constant acid exposure, a classic example of metaplasia. Why not the others? A. Dysplasia is disorganized and abnormal cell growth, which may follow metaplasia but is not the initial step. B. Hypertrophy is an increase in cell size, not cell type change. D. Hyperplasia is an increase in the number of cells, not their type. E. Neoplasia is uncontrolled new growth, often cancerous. USMLE question 2. A 60-year-old man who has smoked cigarettes for over 30 years develops a chronic cough. A lung biopsy shows his bronchial lining has changed from ciliated columnar epithelium to stratified squamous epithelium. What best describes this change? A. Atrophy. B. Apoptosis. C. Hyperplasia. D. Metaplasia. E. Neoplasia. Correct answer, D. Metaplasia. Explanation. The lungs have adapted to the chronic irritant, smoke, by switching to a tougher type of cell. This change is reversible if the irritant is removed but can lead to cancer if it continues. Why not the others? A. Atrophy is a decrease in size or number of cells. B. Apoptosis is programmed cell death, not a cell type replacement. C. Hyperplasia increases cell number, not type. E. Neoplasia involves new, abnormal, uncontrolled cell growth.